Well, good afternoon. I'm going to trust everybody's logging in successfully and joining us. Thank you for joining us this afternoon. My name is Jase Bolger, and I'm the policy advisor for the West Michigan Policy Forum. It's good to be with you today. Throughout this event today, there'll be an opportunity to ask our panelists questions using your chat function. We'll get to that later. In the meantime, I'd like to ask you to take this opportunity to follow us and engage with us on social media. West Michigan Policy Forum can be found on Twitter at WMPF and on Facebook at facebook.com/WM Policy Forum. So look for us on Facebook and Twitter. Those are also on your screen. We share information about our events, about our thought-provoking events, and our public policy discussions happening right here in Michigan. I'm pleased to introduce our West Michigan Policy Forum Chair, John Kennedy, to help kick us off this afternoon. John.
Thank you, Jase. I'm John Kennedy, President and CEO of Autocam Medical. I'm pleased that you could all join us today and talk about the development, distribution, and how our employers should be involved in the COVID-19 vaccinations. I would certainly like to thank the sponsors of the West Michigan Policy Forum, which are now on the screen, for sponsoring this event and many others that we are doing. As we approach the anniversary of the first known case of COVID-19 in Michigan, it's hard not to reflect on the changes in all of our lives. Certainly lost loved ones, economic uncertainty we have all faced, and the sense of anxiety that we all feel. Today's panels will shed light on the topics that will help us move to the new normal. And I'm pleased to welcome representatives from PhRMA, Pfizer, Spectrum Health, Meijer, and Honigman to help us, explore this topic matter. Thank you for joining us for today's event, and I'm going to turn it back to you, Jase.
Thank you, John. As we get started, let's quickly review the West Michigan Policy Forum's policy goal to open Michigan safely and share some key data for where we are with the virus to get to where we are with the vaccine. So if I can beg for permission to share the screen, there we go. I will hope technology comes through. And if anybody's able to share with me, please. Brian, I happen to see you. Are you able to see this screen? I got a thumbs up. Please wave at me if it doesn't move. So West Michigan Policy Forum has had a policy objective, policy priority of opening Michigan safely. Our guiding principles have been safe and sensible. We're going to be guided by the medical experts. We seek to protect both lives and livelihoods as we deal with this pandemic, ultimately to build a healthy economy for all. So since the beginning of this pandemic, the Policy Forum has been urging for 5 responsible actions. Stay home if you're sick. Use masks and social distancing. PPE if you can't socially distant. Extra hygiene and cleaning, and protecting the vulnerable. Today, we want to talk about adding a 6th, and that is vaccinate when available. So where are we now with the virus? So this chart here demonstrates the virus cases by date in Michigan, both confirmed and probable. So you see where we thought we were high in the spring originally in 2020, seeking to manage hospital capacity. We got much higher this last late fall into winter, but we're coming back down. We hope that that remains the case. If we look at where it's coming from, well, the Policy Forum has done several different events focused on how employers are working to keep their employees and their customers safe. And what we're seeing is that the spread overall is not coming from being at work. It's coming from living life. And so we see here, once you remove long-term care facilities, that's the top bar, there really has not been substantial spread from most businesses. And so we want to certainly encourage employers and employees to continue to be safe, but then also take those practices, take those 5 and now 6 things we talked about into your personal life as well. If we look at who COVID is affecting, the purple bars here are cases, the black our deaths. And we see certainly cases have been more prevalent within our youth or younger, dare I say 50 and under, younger, but it's most dangerous for those who are older. You see the rapid rise. If you look at that bar from 40 to 49, and then each decade since, how much that rises as a percent of our deaths. Those are the percent of our deaths due to COVID and where those are, which age groups those are in. So when we talk about protecting the vulnerable, certainly those age groups, those long-term care facilities are some of those that we're talking about. If we look at our rates and how we compare by state, the good news is Michigan is trailing the other states that we've been watching. And we've been watching Indiana, Wisconsin, and Ohio because they border us. And we've been watching Florida in large part because so much of our population goes back and forth between Michigan and Florida. And because Florida's had some different policies. So we've kept an eye open on what that has meant to saving lives and livelihoods. So Michigan is trailing our COVID cases. So these are positive tests or COVID cases. If we look though, Michigan unfortunately has not been trailing most of those states and unfortunately been leading many of those states in our deaths by state. So these two slides have been population adjusted or cases and now deaths per 100,000. You see Indiana has had more population adjusted deaths, but Florida, Wisconsin, and Ohio have all done better at saving lives. That brings us to today and where we're at with the vaccine. So these are vaccine doses administered. The source data is from MDHHS, but I have to credit the Merck group for putting together this slide that we borrowed. I hope they're okay with that. Just to show the rapid rise in the dissemination of vaccines. And what we see here, the rates that are demonstrated are 7-day average, and those are doses per day. So that's kind of where we're at with the virus, where we are with the vaccine. And with that, I'd like to bring together the first panel and ask if Brian Brasser from Spectrum and Jason, Beauch from Meijer. I hope I did that right, Jason. I'm sorry, I'm making a mistake already just on the panel where I'm seeking to instead, not talking about distribution yet, but talk about vaccine development, safety, and rollout. For that, Jessica Frasco from PhRMA and Lisa Coen from Pfizer. So Jessica and Lisa, thank you for joining us. My apologies for that transition, and hope you can help us understand this vaccine, how it was developed, and tell us all about the vaccine, everything we should know.
That's awesome. Thanks so much, Jase. Unfortunately, I have that I can't share while the participant is sharing. Yeah, let's see now. Okay, perfect. Let's see. Can you all see that screen?
There we go.
Perfect.
Yes.
Okay, great. Well, I really appreciate the opportunity to speak with all of you today because as the vaccines become more accessible to patients in each state, we know that comes with an influx of questions about vaccine safety and efficacy. So we wanted to provide you with some information that may assist you in making informed decisions when a vaccine becomes available to you. As of December, the FDA approved the first 2 vaccines created by Pfizer and Moderna, which both utilize mRNA technology. And the FDA will meet to review the Johnson & Johnson vaccine on February 26th. Regardless of the type of COVID-19 vaccine, all but the J&J vaccine will require the 2 shots. The first builds protection and the second maximizes that protection. And the most common side effects of the 2 mRNA vaccines are typical of those exhibited for other vaccines, and you see those here on the screen. There have been rare occurrences of anaphylaxis, which the CDC is monitoring along with manufacturers and healthcare professionals. Participants in the US clinical trials for the 2 COVID-19 vaccines are more racially and ethnically diverse than most trials, which is definitely an improvement. However, we're committed to addressing disparities and breaking down barriers that create obstacles for communities of color, who are still underrepresented compared to their share of the US population. Over 21% of participants in each of the clinical studies for Pfizer and Moderna were 65 years or older, which is important because these patients are considered more vulnerable to the virus, as we just saw by the slides that Jase presented. Patients with chronic conditions were also treated during the clinical trials, which gives us confidence about patients in the population at large taking the medication. Just like most clinical trials, certain populations, including pregnant women and immunocompromised patients, were not included. These patients are encouraged to consult their physician before they're receiving the vaccine. While children under 16 are not currently eligible for either vaccine because they weren't included in the initial clinical trials, Pfizer and Moderna are currently initiating trials for adolescents and teens now that the vaccine has been proven safe and effective for adults. And while it's absolutely incredible that we have vaccines just 1 year after COVID was identified, it's important to know that the COVID-19 vaccines went through identical processes of research, clinical trials, review, and scrutiny that all other vaccines are required to go through in the United States. Instead, we've been able to achieve this unprecedented pace due to 4 main components. First, we decoded the virus in a matter of weeks when that process had previously taken years to undergo. And that was really possible because of international collaboration and the sharing of the full genetic sequence at the start. Improvements in technology have also dramatically shortened the time it takes to decode viruses and create potential vaccines. Companies narrowed down potential candidates by reviewing their R&D product libraries, which allowed researchers to build up existing medications for other infectious diseases that share similarities to COVID-19, such as MERS and SARS. And at the onset of clinical trials, many manufacturers simultaneously developed the manufacturing method, which is typically a multi-year undertaking. However, companies scaled up production so that they could meet the needs of the current pandemic as soon as they received regulatory approval. So in essence, thanks to decades-long investment in new technology and research, collaboration and advanced investment before approval, biopharmaceutical companies have acted really swiftly without cutting any corners. There's also been significant updates in clinical trials. Traditionally, participants in clinical trials are managed on-site at hospitals or clinics, which can create challenges to recruitment if patients need to travel to sites in order to participate. But with COVID-19, some sponsors have decentralized these clinical trials, meaning that patients are able to participate remotely using digital technologies and telehealth. These tools can help remove some of the barriers that slow down recruitment and can help reach a more diverse group of patients. The FDA's approval through an emergency use authorization also expedited the public's access to the vaccine. The FDA typically takes 6 to 10 months to review a new medication, but the FDA is placing top priority on the COVID-19 vaccines by calling immediate meetings of the advisory committee, allowing these needed medications to move to the top of the review list. Now that COVID-19 vaccines are available to the public, we have to also consider how this impacts the way we live in a COVID-19 world. It's important to know that everyone, including those who received the vaccine, have to continue covering their mouth and nose with a mask, washing their hands often, and socially distancing, as well as limiting group engagement. Experts need to understand more about the protection that the vaccines provide under real-life conditions before deciding to change those recommendations, so that everyone can help to slow the spread of the virus. Other factors, including how many people get vaccinated and how the virus is spreading in communities, will also affect that decision. So for more information, I encourage you to visit pharma.org/coronavirus. I'm also going to share some resources with the team that they can post on their website or in their newsletter if you're looking for a more in-depth analysis and information. And that's it for me.
Jessica, thank you very much. Lisa, as we turn to you, I just have to share that we were so proud to see those trucks rolling out of Portage, Michigan with those first vaccines, and then to see them flying out of Gerald R. Ford Airport to go to the world, at least to the rest of the country, but all over the world, I'm sure, if not now, soon. So please, Lisa, fill us in on Pfizer specific related to the development of the vaccine.
Jase, thanks so much. And I just have to say at Pfizer, we're really proud to be in Michigan. So thank you for those really nice comments. Thanks everybody for having me today. Really, really glad to be here. I'm Lisa Coen and I lead US Public Affairs for Pfizer vaccines. So it's been a little busy the last year, but what I want to try to do is touch on the Pfizer-BioNTech COVID-19 vaccine program and distribution efforts. I need to just read a short statement about the vaccine. So the Pfizer-BioNTech COVID-19 vaccine has not been approved or licensed by the FDA, but has been approved, but has been authorized for emergency use by FDA under an emergency use authorization to prevent COVID-19 for use in individuals 16 years of age and older. And if you're looking for more detail, we have an EUA fact sheet at a website that we've set up specific to our vaccine. It's at cvdvaccine-us.com. So I wanted to touch on the vaccine candidate, lots of questions around mRNA technology. So again, our COVID-19 vaccine is mRNA based and it encodes an optimized SARS-CoV-2 full-length spike protein, which is a key neutralization antigen. So it fights the virus. But what does that mean? So let me break it down just a little bit more. The mRNA vaccines work differently from common vaccines. Significantly, mRNA vaccines do not contain any virus particles. Instead, they provide essentially a recipe that teaches our own cells to make a part of the COVID-19 virus that's called the spike protein. The idea is stop the spike protein and you can stop infection. So here's what happens. You get a shot of the vaccine in your arm. The vaccine gets into your cells and it teaches your cells how to make a version of the COVID-19 spike protein, which is released into your bloodstream. Your immune system, the part of your body that protects you from disease, recognizes the spike protein as foreign. It creates a response that we believe enables your body to remember the spike protein. The expectation is that if you're exposed to the actual COVID-19 spike protein in the future, your immune system will remember the spike protein that your body made after vaccination and take steps to protect you from developing COVID-19. A few things to underscore. Our vaccine is a 2-dose vaccine administered 3 weeks apart. It's not interchangeable with any other vaccine. It does not contain live virus, and the mRNA does not alter your DNA, but is eliminated from your body. Also, the vaccine is preservative-free. If you want to find out more about components of the vaccine, again, please look at our EUA fact sheet. That's at cvdvaccine-us.com. So the clinical trial timeline, you heard Jessica, she talked a bit about that, but let me touch on some highlights. So it was only last May when we were able to begin the phase 1/2 trial of 4 potential vaccine candidates. And then in late July last year, we selected 1 candidate and began the phase 2/3 trial, eventually enrolling over 46,000 participants. That's really large for a vaccine clinical trial. We've conducted the trials in approximately 153 sites across the world in 6 countries and 39 states in the US. Our trial participants are ages 12 to 85, and in the US, 30% have racially and ethnically diverse backgrounds. Approximately 40% are ages 56 to 85. Of the 30% with diverse backgrounds, 13% are Hispanic, 10% Black, 6% Asian, and 1.3% Native American. On December 11th, the FDA granted EUA for the Pfizer-BioNTech COVID-19 vaccine. That was the first in our country for a COVID-19 vaccine. The day after, the CDC's ACIP recommended our vaccine for persons 16 years of age and older under the terms of the EUA. So I'd like to note, and this is really, echoing a point that Jessica made, the approach we've taken to be able to bring the vaccine to this point on an advanced timeline is not one that cut any corners. Our team has ensured that the science is driving the process and that we can meet FDA's rigorous regulatory standards. The clinical trial has been a continuous study with regular discussions with regulatory authorities along the way. This allowed decisions to be made in near real time with regulatory authorities like the FDA. Let me switch to manufacturing and supply. So in terms of manufacturing, we've been ramping up this work at the same time we've conducted the clinical trials. That's unusual in our business, to make that type of at-risk investment before knowing if the vaccine would even be successful. But because of the urgency of the pandemic, our leadership made that decision early on. In late July 2020, Pfizer was able to announce our first agreement with the US government to supply 100 million doses of our vaccine once it was authorized or approved. In late December, after we'd received EUA, we announced a separate agreement with the US government to supply another 100 million doses in 2021. That brings the total to 200 million doses that can vaccinate 100 million people. The US government has the option to purchase 400 million more doses from us. So globally, we now believe that we can deliver up to 2 billion doses by the end of 2021. How did we do that? This is based in part on our updated label. So we were able, just a few weeks ago, with FDA's help, to update the label so that you can now get 6 doses instead of 5 out of each vial of our vaccine. We've also worked on continuous process improvements and expansion at our current facilities and the ability to add more suppliers and contract manufacturers to our network. In the US, we're now planning to provide 120 million doses to the US government by the end of March 2021. That's a 20% improvement over our contract schedule. And we expect to deliver the next 80 million doses to the US by the end of May. That advances our timeline by 2 months. So as you can imagine, a huge focus of our team's time right now is on how the vaccine is being distributed. We're working closely with the federal government on production, release, and shipping schedules to help ensure Americans can receive their first and second doses of the vaccine on time. We foresee no issues in delivering on the commitments we've made to the US government. The facility in Kalamazoo, Michigan is the primary manufacturing site of our COVID-19 vaccine in the US, and we've shipped more than 34 million doses to destinations across the US as of today. We anticipate no interruptions in shipments at this facility as we look to scale up in 2021. This is an extraordinary undertaking. It's taken collaboration among federal, state, and local officials, industry, public health leaders, healthcare providers, nurses, pharmacists, and so many others. But we know all states are in need of more doses of COVID-19 vaccine. And our commitment at Pfizer is to continue to work tirelessly to be as transparent as possible about our supply efforts and to ramp up our manufacturing capacity to help meet demand and combat the pandemic. So I just wanted to close there, but note again, we're so proud of our colleagues, particularly in Kalamazoo. And everyone has worked tirelessly this past year to help advance the vaccine, given the urgent need from the pandemic. But I also have to point to the collaboration with state officials, regulatory officials at the FDA, public health leaders at the CDC, and so many others who have worked all at the same time together to develop and implement a vaccine distribution program. So I'm going to stop there and hopefully we've got time for a couple questions.
Thank you, Lisa. Please, anybody who has a question, enter it into your chat function. We'll seek to get it, and I'll toss this to either Lisa, you, or Jessica, whoever's more comfortable. I think 2 questions I'll lump together, you separate them if they need to be. And one is, if it doesn't contain the virus, why are some side effects? Why am I hearing of people who are getting a fever, who are feeling punky or tired after especially a second dose of the vaccine? And then the other is, what do we know, or what do we think we know about your vaccine or the vaccines that are out there as well, or as they relate to the variants we're starting to hear about, whether that's from the UK or South Africa?
Really good questions. Jessica, do you want me to start?
Yeah, go for it. Absolutely.
Okay. So Jase, I think on the first, with the side effects that we're seeing, they're very common. They're actually very mild. And what generally people see when they get a vaccine, first or second dose, right, is you might have some site pain, so that, something around the injection site, and fatigue or headache. And that's exactly the same with the Pfizer-BioNTech vaccine. The reason that you see after the second dose, what appears to be, stronger effects, but also, along those same lines, is because your body is reacting to the vaccine. It's working, right? And so you'll see, because you stepped up the dose, right? You had 130 microgram dose. Now you have your second 3 weeks later. It's your body reacting to that and doing what it needs to do to prepare your immune system. The second question on the variants, the second question is so timely, so important. So what Pfizer's been able to do is do specific studies of the in vitro sera of those who've already been immunized from our vaccine. But it's to look at the exposure to the mutations and to see how the vaccine would do. And what's been so encouraging from all of the information we've gathered over the last month is that there's still very good protection. There is slightly less protection, and you talked about different variants. People hear about a South African variant, and it was slightly less effective against that. So one of the strategies that our chief scientific officer is talking about, and we're engaging with the FDA on a plan about, is to consider whether a booster dose would be needed. And that's something that would be developed specific to that strain. And the other thing, Jase, that we could do, and this is all under discussion with the FDA, is you could also change the underlying vaccine. So it sounds like what we do with flu every year, right, is you look at those prevalent strains and you say, what do we really need? But those are under discussion, and I would say look for FDA a little later this month to announce more details on what it expects and what the companies would need to do to satisfy their requirements.
All right, so Jessica, I'm going to throw two quick ones to you. We're not going to have enough time for all the questions that I see popping up, but I hope you could hit two quickly. One is, after I have a second dose of whichever, how long does it take for me to reach my maximum protection that will come from that second dose? And then the other is, if I don't have a reaction to the dose, if I don't get a headache, if I don't get a fever or feel funky, does that mean it didn't work for me?
Yeah, absolutely. So Lisa, feel free to chime in on anything that you feel is specific to the Pfizer vaccine. But, when we've been talking to medical professionals, the feeling is that 6 weeks after your second shot, your body is at full protection and is really maximizing the second shot and the booster that it received. But I have to say that regardless of whether you have received the first shot or the second shot, or you're 6 weeks after the second shot, your socialization and your habits should not change at all. And so it's an added level of knowledge and protection for you to have personally. You're not going to feel anything different at 6 weeks, but you also shouldn't be doing anything different at 6 weeks. And so that's kind of the initial, that's the answer to question one. As to question two, everybody's bodies react very differently. Just like when some people get a flu vaccine, not that these vaccines are in any way similar, but in the fact that they are vaccines, they share kind of similar qualities that all individuals have. So if you have a grandmother who had a specific reaction to her flu shot versus your child, or a family member who may have a chronic condition, everybody kind of responds differently, and that's okay too. It's not an indication that somebody's body is fighting it better than the other ones, or building that protection in advance of getting infected compared to other ones. But one other thing that I did want to note just really quickly in response to that is I've heard a lot of questions about individuals getting COVID-19 after they've gotten that first shot. And I kind of just thought that that was important to address too, because your body is building up that immunity and that resistance. And so the cases in which somebody has gotten COVID-19 by freak incidence and chance between their first and their second shot, they have significantly less side effects, and their reaction to the virus is significantly less. Hospitalizations are down. So those are really promising signs too. So I think that that's not to say you shouldn't get the second shot. You should absolutely get it. But I feel like that's been a common question that I've gotten from a lot of people. And so we're just trying to build the most protection and the most immunity through that second shot and keep you protected throughout the whole process.
Jessica, Lisa, thank you very much. We've got many more questions we wish we could ask you. Maybe we'll follow up and try to get questions asked that you might be able to answer, and then we can get that information back out to those. Sorry to everyone that I didn't get to all the questions that you submitted, but due to time, I unfortunately have to move on. So thank you again, Jessica and Lisa, for joining us and for your information and for your work right here in Michigan. That's always exciting to see. So next up, we've talked about the development of the vaccine. What is the vaccine? Now we want to talk about getting it into arms. And so I want to welcome Brian Brasser, the Senior Vice President, Chief Operating Officer at Spectrum Health, and Jason Beauch. My apologies, Jason, for struggling over your name. I not only had the wrong time, I had the wrong pronunciation. Vice President of Pharmacy at Meijer. So Brian and Jason, if you can join us and take it away, that would be much appreciated.
Great, thank you, Jase. Get my video started here. By way of introduction, my name is Brian Brasser. I have been privileged to work at Spectrum Health for the last 30 years or so. I'm an RN by training. I've been in various leadership roles across Spectrum Health over the last 25 years. Currently, as you see, I do serve as the Chief Operating Officer for our hospitals in Grand Rapids. And I've also had the privilege of serving in our command center as the executive in command for the better part of the last 11 months. And just sharing from the perspective of distribution from the perspective of the health system, I will say that these last 11 months, I think it's affected all of us. There's no doubt about it. And I can say that, we've run on adrenaline for most of these 11 months. We ran on adrenaline early as it related to fear and dread. That fear and dread returned in the fall. And I think the adrenaline we're running on now is filled with hope and optimism. And I think that is so encouraging as we collaborate with other organizations across West Michigan to really work to get shots in arms. And so if we go to the next slide, most of you are familiar with Spectrum Health. But this slide is really intended to show the breadth and depth of our organization, which has been really important in our overall response to the pandemic. So partnering within our own hospitals, partnering with our medical group to be able to redeploy providers when we needed them at the bedside, winding down elective procedures so that we could cross-train. And then from the payer perspective, the importance of that role, and ultimately as an integrated not-for-profit health system based right here in West Michigan, that has really helped us weather the storm and thrive to meet the needs of our communities. And it has helped us as it has enabled us to create a very robust response to the task at hand, which is to get shots in arms in the most appropriate, ethical, and safe way possible. Next slide, please. So I'm sure we're all quite familiar with the current phasing process. As you know, the state follows very closely the CDC recommendations. The state laid out a pretty robust plan in the fall as we got closer and closer to the implementation of vaccines and the first emergency use authorization. And then we've learned together as we proceeded through here. So right now, we started with, we're continuing to work with healthcare providers. So we started back in December, on December 14th. We were the first organization in the state of Michigan to administer a vaccine outside of any trial, and that was to one of our critical care physicians. And then in January, we expanded into that phase 1B, as you can see on the right. So that is those in our population who are 65 and over, those who work in the school setting, K through 12, law enforcement, and those working in prisons. Next slide, please. So the picture on the left is Dr. McClelland, who is one of our ICU physicians. And you can see that there's various settings in which we are now providing vaccines to our community. It was very important as we stood up this process that we were finding ways for us to identify those who were qualified. And it was a challenge early on when it was the phase 1A. We could move through our team members, we could move through those who were directly at the front line, and we started there. We are directed to include those who are supporting our healthcare infrastructure, because recognizing the importance of healthcare amidst the pandemic, and certainly as we were coming out of the surge in the fall that we saw in Jase's graphics early in the presentation. Next slide, please. One of the ways that we have really focused on connecting with our community is making it easy to sign up. We've tried very hard to communicate not only the phases and to help to extend the messaging that was coming from MDHHS, the CDC, and others, but to allow people to sign up easily. And that did not happen overnight. As you know, we moved relatively quickly and quicker than anticipated into 1B. And so we, like many other organizations, and it turned out to be a bit of a barrier. So we worked very hard to move our registration process outside of an online portal-driven Epic on the Epic chassis, and into one that was web-based, was much easier to use, easier to understand, and more simple. It was released in both English and Spanish, and that was just one way that we were signing up community members. The other was by phone. So those who either were challenged with internet connectivity, they didn't have a way to connect by internet. We've hired 100 additional team members, so that we have over 200 people answering our call lines so that people can register, again, to get in line so that they can be notified when the time comes that they are ready and we have a vaccine available for them. That's been a bit of a challenge to stay connected. And so at this time, we are able to communicate to those that are in our queue. Right now, it's about 125,000 people. And we communicate every 2 weeks to say, you're good, we've got you, we will continue, you're in line, we will notify you when you're eligible and when we have a vaccine available to you. Next slide, please. We've been able to leverage the relationships that have been so important to us, certainly before the pandemic, but as the pandemic has evolved over the last 11 months. We've taken great pride in being a source of truth for the community. We've taken great pride in connecting with different organizations, and we've also taken great pride. On the left, you can see some of our efforts to connect with the Spanish speaking segment of our community. And so recognizing the importance of connecting with those influencers using all different types of media, that has really played an important role in this part of the pandemic as we're trying to educate on the safety and efficacy of the vaccine, as we're trying to make sure that this is not just those who have access to a portal get in line first, but rather that we're approaching this with an ethical framework. We're trying to remove barriers and to make sure that how we administer those vaccines, both in terms of choosing who is eligible and who is ready, is done in a fair and equitable way. Next slide, please. So these relationships have proven to be very, very important. And what you see here is a really, it's neat, organic. This is actually the Vaccinate West Michigan group. So each of these entities, some of them are pharmacies, some of these are universities and colleges, they're health systems, they're health departments. They have come together over the past 4 or 5 months to coordinate and collaborate so that our efforts to vaccinate our communities at large have been as organized as possible. Our health departments function largely independently. And so bringing our health departments and our hospitals, our health systems, to bring our pharmacies and our colleges and universities together has really allowed us to have a much more unified approach across West Michigan. And it's been singled out as really a great model that our side of the state has been able to deploy in order to coordinate our efforts. That's not unlike what we did with the health systems as we navigated the fall surge together. We initiated a call that occurred every Monday, Wednesday, Friday, and it was attended by over 20 different health systems and hospitals where we could compare notes, we could compare how we were handling the surge and support one another, whether it was through the sharing of expertise, or it was through the alignment of the latest information that was coming from Lansing or Washington, D.C. Next slide, please. These images are from our mass vaccination site in downtown Grand Rapids at the West Michigan Vaccine Clinic. This is a collaborative effort led by the Kent County Health Department in collaboration with Spectrum Health, Mercy Health St. Mary's, and with the support of the Vaccinate West Michigan group. We know that this is an important element of a well-rounded, community-based approach. And so we're going to talk about a couple of different approaches. I'm going to introduce a couple of those, and then I'll hand it off to Jason. But this is one of those that we think is really important. Now, it's predicated on having ample supply of vaccines. And what we just heard is, and what we're hearing in the media is that that time will be coming, and it hopefully will be coming soon. We know that a site like this is not for everybody. We know that a site like this, though, helps us to move and get more and more people vaccinated quickly. We have the good fortune of living in West Michigan, where we have a long and storied history of philanthropy. The space at DeVos Place is set up ideally for this because we're able to spread out, we're able to social distance while we bring people together. Everyone must wear masks. Everyone gets their temperature checked at the door. Frequent hand hygiene and that social distancing, coupled with natural light and good airflow, allow this to be a safe place that many communities don't have at their disposal. So we are very excited about the fact that last week we did 13,000 vaccines, but that represents what we can do in about 12 hours if we have unfettered access to vaccines. So this is important for people who have no mobility barriers. We're on a bus line, we have free parking, but it does require movement to get there. And so the next, if you can move to the next slide, the other way that we are approaching this at Spectrum Health and many health systems are through smaller community-based clinics. So those are in our regional hospitals. Those are in churches in zip codes that are disproportionately affected. Those are connecting with communities and focusing on certain zip codes, certain communities, and partnering with community leaders and church leaders to make that a reality. Next slide, please. And so at Spectrum Health, again, we're an integrated health system across the west side of the state. Each of those areas represent not only our hospitals, but where we are giving vaccines. This week, we have vaccine clinics in all of these locations, and sometimes these represent 2 or 3 different locations. Happy to report that we've given right around 95,000 doses, and we're poised to do much, much more. Next slide, please. So before I turn it to Jason, just to summarize, what we have found is so important on this is over-communicate and over-listen. Connecting with our community is essential. Try to make it as simple as possible, because sometimes we're so far in the weeds, what makes perfect sense to us can present a real barrier, which could be magnified if there are learning disabilities, if there's language barriers. We know that a one-size-fits-all approach does not work, and so we have to really look for ways for us to connect with our community and meet the needs of the community and meet them where they are. We know that we are all called, and we can hear that as a priority at both the state and federal level, to make sure that we are really focusing our efforts on the vulnerable as well as large-scale sites. And it's important to have a plan, but to be ready to modify that plan, to learn as new information becomes available. And it's important to remember that we truly are all in this together. We've heard that throughout the pandemic, but the only way we get out of this pandemic is through our partnerships. And it's been very, very important to us thus far. With that, I will turn it over to Jason.
Thank you, Brian. I've been asked to make up a little bit of time here, so you guys will have to forgive me. Brian, can you, okay, you guys can hear me, it looks like. So I will go at rapid speed, but hopefully not too fast that I miss the point. But welcome. Wanted to give some coverage on how Meijer is going to play an important role with the vaccine here in West Michigan. You can pull me forward to the next slide. This simply shows the 5 vaccines that we hope will make it to the market. Obviously, the first 2 are available today, and the Johnson & Johnson product will be reviewed later this month by the FDA, hopefully bringing a 3rd product to the marketplace. You can pull me ahead one. Here, I think Brian talked about it, but right now, Meijer's role with vaccinating our community is really in the 65 and above senior population. We hope to bring it to others here in the near future, and you've heard some rumblings of potentially April of this year, but we'll see what when we actually get access to vaccinate everyone who is eligible. You can pull me ahead one. From a Meijer perspective, we're partnered with the CDC and the federal government to receive vaccine in our Michigan locations. We're also partnered with the state of Michigan, the state of Indiana, Ohio, and Wisconsin, who sends us vaccine directly into select locations. And we have county health departments that provide vaccine in certain areas as well. In West Michigan, the biggest sites that we've had thus far are in Muskegon, in Benton Harbor, in Grand Rapids, Kalamazoo thus far, and we anticipate bringing vaccine to more and more locations as supply increases. Our team today is about 1,400 vaccinators across our 6 states. We got a little catching up to do to catch Brian, but by tomorrow we'll have vaccinated 60,000 people. We've got our first doses about 4 weeks ago today. If you pull me ahead one more slide, what we've done to really maximize our capacity at Meijer is actually create 30 dedicated vaccination teams that travel around. They're made up of about 12 to 15 clinicians that can vaccinate people every 5 minutes. We also have store team members that help with kind of traffic flow and making sure people are in the right place and that waiting can be minimized by greeting customers at the door to bring them in. We've actually cleared out portions of our store to allow for proper spacing. One of the benefits of having a super center is a lot of space to make sure people are distanced and safe and have chairs to wait in. But honestly, our process for these big clinics of 1,000 to 2,000 doses in 8 hours have been well received and very quick from a process standpoint. You can pull me forward one more. To individually register, so if you wanted to register yourself or a loved one, especially those 65 and above, we've tried to make it really easy. We collect some simple information like your name, address, contact info. We obviously ask the 3 primary questions for phasing, if you're a healthcare worker, if you're an essential worker, or if you have any underlying comorbidities to help properly phase you once the state changes the phasing. But for now, really, we're driving off of the date of birth. If you pull me forward one, it gives a really good visual of here are all the ways to simply register. You can text the word COVID to the number 75049. You can go to Meijer.com. There will be a banner ad that you can click on to register. You can go to any of our Meijer apps and there will also be a banner, or you can simply go to clinic.meijer.com to register as well. If you pull me forward one more, kind of go through the process. So once we have a clinic in your area and you're eligible, we'll send you a simple text message that you'd click on. In that message, you'd be able to say, yes, I'd like to attend. No, I'd like to defer to a different date, or no, I'd like to opt out. Maybe I've already received my vaccine from Spectrum Health or others that are providing this to the community. Pull me forward one more. Here's some simple customer feedback. It's been an outstanding response. You may have seen some of the TV media that's been out there. The customer letters have been absolutely wonderful. And I can tell you from experience of attending some of these clinics, people are just absolutely grateful and kind of overwhelmed with joy to receive the vaccine. So it's been a rewarding process for our team. And then I think I have maybe a couple more. Oh, maybe not.
We'll go right to Q&A. Let's hit you with some tough but quick rapid fire. So Jason, I'm going to give you 2, and that is, which vaccine's the best? And should I hold out for one? And then also hit, if you would, can I sign up on more than one wait list? If I'm on one, should I sign up on another?
Yeah, of course, Jase. So the first question is you should take the vaccine that's first available to you, whether that's Pfizer, whether that's Moderna, whether in a month from now that's J&J. I would absolutely recommend taking the first one that's made available to you. And as far as registering, We do think that it's okay to register with multiple providers for the vaccine. What I would definitely caution and recommend against is scheduling appointments at multiple providers. Obviously, the difference between registering is that you're kind of on a wait list, and an appointment that's an actual appointment to get vaccinated.
So signing up on the wait list is raising my hand, but if I get called on, only go to one place. Don't create an appointment where nobody shows at a different place.
Absolutely, because you're taking that appointment from somebody else.
Right, okay. And Brian, you got little time to answer two tough questions. First, we go back early in our presentation, we looked at the danger by age. And I'm wondering, shouldn't we just have a system that's based by age instead of the complexity of 1A, B, C? That would be first. And the second one is brand new, and that is, when can I get mine? Dr. Fauci said today he anticipates open season, was his word, in April, as soon as April. So why do we have just an age-based system? And what does Dr. Fauci mean by an open season in April?
Yeah, Jase, the data you shared was really compelling. And I think, there's just a number of ways to look at this. I think one thing that we're finding through this whole process is that the more you can reduce complexity, the better. And also, the more precise you try to get, sometimes you're actually creating ethical barriers, because it means that, so for example, as comorbidities, if comorbidities play a role as we're expected to be based on the plan, then the question is how do you find out people's comorbidities? If you're dividing people by where they work, how do you validate that? Do you need to demonstrate a pay stub? And so, as you know, the plan that's in place, we've already seen that the MDHHS, the governor, has modified that based on feedback and made it a bit more clear for us. We're seeing how other states are reacting. I think it's a legitimate question, and I think what I think we've got a commitment to is to go by the data, and I think that is some pretty compelling data that you shared there. The second piece would be I was very encouraged by what I heard from Dr. Fauci, because what's a bit of an unknown is we have great communication with the state. We might not always agree with the decisions that are made in terms of allocations, but I will tell you that they've done just an incredible job of making sure that they're connected with the health systems, making sure they're connected with the health departments multiple times a week. And so what we don't know is that what's the flow of those vaccines before they get to the state? And I think that Dr. Fauci probably has a better view than I certainly do. And if he's confident that the flow of vaccines will truly ramp up to the point that we'll get through whatever order that may be, but essentially what I think I heard him say is we're going to get to phase 2, to open season by April. I will tell you that will take what we have set as a framework for the state, and that will accelerate that by quite a few months. So I hope that that's true, but we're going to focus on the here and now, and how do we find those 65-year-olds? How do we break down barriers? How do we make sure that we're breaking down the barriers to health equity? And we'll respond as the conditions change.
Jason, Brian, thank you both for your work. Thank you for joining us here today. And once again, we've run out of time. We've got more questions than time. So we'll try to get that feedback through you to those who have attended where we didn't get those questions answered. Because unfortunately, our time is up here, but fortunately we get to bring forward Sean Crotty from Honigman to talk about the law and employers and some things that employers might need to, or might be asking or should consider as it relates to vaccine distribution. Sean.
Sure, thank you. And I'll move very quickly. Usually I like to get paid by the word, but we're volunteering for this great organization, so I can move fast.
We've called on the attorney to be quick at the end, huh? That's thank you.
All right, so employers can be a great partner in helping expand the pool of vaccinated individuals. And there are really 5 legal considerations that employers have to consider. And I'm going to skip my PowerPoint and just speak directly, or maybe we can just move to the next slide because that covers them. The first is, must you require individuals to get vaccinated? The answer to that is no. OSHA came out with guidance just recently, did not require employers to force the vaccine. Instead, OSHA said employers should make it available to employees at no cost, but they stopped short of mandating that employers in turn mandate it. That may change as state and local laws change. The law doesn't move as fast as Pfizer and Spectrum and Meijer. So we need to keep watching that, but right now you don't have to mandate it among your employees. The second legal question is, can you as an employer mandate it? The answer is yes. The EEOC came out and said, yes, you can mandate it. You can require employees to show proof that they've been vaccinated. And there are two important exceptions you have to consider. One is employees who have an objection based on a disability. And the second is employees who have an objection based on a sincerely held religious belief. You don't have to accommodate generalized fear or ethical obligations to the vaccine. It's really just those two. And when we say accommodate, that doesn't mean the employee gets a free pass and you just need to let them back into the office or the workplace without being vaccinated. Instead, you have to assess whether they pose a direct threat to other employees by not being vaccinated. And that will depend on where they work and what type of PPE that they have, and whether there are accommodations that could allow them to still work without being vaccinated. Next, can you incentivize employees to get it? The answer there is yes, you can. There are legal issues associated with it. Let me hit the two quick ones. If you offer cash, it's taxable income, and it's often considered compensation for part of your 401k program. So look at that. And the second legal issue associated with incentivizing it is there's a lot of vagueness as to whether you can do it through your employee wellness program. We recommend don't do it through your wellness program. Just do it outside of that program, and it's a lot safer because the rules on that are changing. The next legal consideration is, how do you structure a program? There's a lot of trickiness to that. And my general recommendation, not surprisingly, is call your lawyer, because they can help you define this. There are practical considerations in terms of timing, in terms of employee morale, and whether you're going to do mandatory, incentive-based, or be neutral, or do a hybrid where you're mandatory for some and incentive for others. So there are a lot of considerations, particularly on the wage front, on the traditional labor front, if you've got a union, and then issues with data privacy. So call your lawyer. And then lastly, what should you do? What else should you do once people start to get vaccinated? First, keep up with your policies. Vaccination doesn't mean you get to start letting people go without masks or the like. You need to keep your pandemic response plan in place, keep the band together with respect to your pandemic response team, and keep doing all those great things you've been doing to protect your employees. Second, have a policy. Whether you're mandating it or whether you're incentivizing, have a written policy so people understand it. Third, train HR, train your HR folks, train your employees, especially if you're mandating it. When you're mandating it, dealing with those exceptions for disability and sincerely held religious beliefs is very tricky. And the HR folks really need to be trained. And finally, monitor this area for changes. The ground is still shifting beneath our feet on the legal front. We're still waiting to see where things shake out on a federal level, especially with the change in administration. And we're still going to expect to see more changes on the state and local level. And with that, I'll turn it back to Jase.
Thank you very much, Sean. A lot of information packed in there in a short period. We appreciate your tackling that for us. Our hour is up, but I want to extend some final thank yous. Thank you to our panelists for joining us. Thank you for your work to not only go into this, but your work to make sure that our community recovers as safely and effectively as we can. I want to extend a special thank you to our Kalamazoo team and our Kalamazoo members. We got to highlight Pfizer and Portage, Kalamazoo area today, but I know you were willing to have us in person, although the pandemic wouldn't allow right now. So thank you for helping us pull this together virtually today. So I want to leave you with, we want to open Michigan safely. We want to protect lives and livelihoods. We want to ensure a healthy economy for all. We've been talking about 5 responsible actions: masks, social distancing, PPE, hygiene, staying home if you're sick, and protecting the vulnerable. Now we want to add a 6th, and that is get the vaccine. So please sign up with Meijer, Spectrum, or other. Exercise grace, trust the process, take the vaccine, and encourage your family, friends, and neighbors to do the same. Thank you for joining us.